Hi everyone, and welcome back to another episode of Advocating for the Aging. My name is Victoria Shull. I am an attorney at Locke's Law Firm, and I am a nursing home abuse and neglect trial attorney. And today we have another very special guest. I know I keep saying this, but everybody I just am so excited to highlight because everybody brings something different to the table. And today we have Trish Barbosa. She is a certified geriatric care manager, aging life care professional, and she's the president and principal of Peace Aging Care Experts, LLC. Yes. So I'm really excited to have you here today, Trish, because I want people to understand what you do. As we were just talking about before the show, you fill a gap and a huge need that people don't even know exists, right?
Yes, exactly.
So tell us a little bit about who you are, what you do, and how you got into it.
Sure. So I'm a registered nurse. I've been a registered nurse for a long time, and I've worked in many different areas of nursing: the hospital, home care, even insurance, case management. And one day I really was just unhappy at my job, and I was thinking, I want to do something different. I have these skills, and who else might be able to use them? So, how else could I maybe help someone? And I thought, you know what? There are a lot of elderly people. We have baby boomers aging. I've helped a lot of my family members with their health issues as they've aged, and I thought I invented the field of geriatric care management. But once I started to explore it a little further, I found that there was a professional association for this small cottage industry of healthcare professionals who provide this kind of service to people.
So what does a geriatric care manager do?
Well, it started out as a social work field. There were social workers working with folks in New York with health issues. Maybe their families didn't live nearby, and they were helping to advocate and coordinate their care for them. And it just grew and grew. So now most of the people who do this work come to it from a background of nursing or social work, although there are other people from other fields that do this work as well. In fact, I have an occupational therapist on my staff, but there are gerontologists and other sorts of healthcare professionals who do this work. And what we do is we typically meet with families who are dealing with the challenges of caring for an aging or disabled family member, not knowing where to turn, not knowing the difference between a nursing home, assisted living, or getting caught in the healthcare system and just not understanding how it's paid for and how it operates.
And that's so important. I can't tell you how many people call me when something's happened in a place, and they say, I didn't know. I didn't know that, she was going to end up getting sent to a nursing home. If I had known I could get home physical therapy, or I would have definitely have done that rather than go from a hospital to a nursing home, and then something happens there, and now they're there for a long period of time. Right. And that was never what anybody ever planned for. And to know that there's options out there. I think so many people don't even know that your services exist, but that other services exist that might suit somebody's wants and needs more appropriately, right?
Right.
So when somebody contacts you, what types of things do you talk to them about? How do you try to put them in the right direction as to what they may need?
Sure. If someone calls our office, typically something's happening that's not great in their situation. Either, their loved one might have dementia and isn't caring for him or herself and won't take assistance, or it could just be, mom fell and broke her hip, where it's a real crisis where we need to just kind of jump in. So what we do is we schedule an appointment to go out and do an assessment and get to know the parent or the elderly person and kind of see how they're living. We don't typically have clients come to our office. We like to see where they're living because we can learn so much from that.
Right.
And we identify different needs. We talk to the family about financial resources because a lot of the care that their loved one's going to need is going to be private pay. And there's a strategy to making sure that we can make that money last. And when the money runs out, they can continue that same level of care by tapping into Medicaid or other sorts of resources.
So do you help people to figure out how to handle the money, or is that something that you then refer out to an elder law attorney? How is that part handled?
Right. Well, we certainly work with elder law attorneys. In fact, I always say it's a perfect pairing, because the elder law attorney, in some cases, in most cases, the money isn't going to last forever. So the elder law attorney will meet with the family up front, talk about planning for Medicaid, and then once the elder law attorney knows how much money is going to need to be spent before Medicaid will pick up, then as care managers, we know what the budget is. Right. So we know now, can they afford assisted living if that's an appropriate level of care? Or, not all nursing homes are the same. Some require some private payment before you transition to Medicaid, and we know where the care is the best. So we work with families to help ensure that they make the best decisions and feel comfortable about the decisions that they're making, that we call it having the long view, right, and sharing that with the family.
Right.
Yeah.
So when you're looking at, so you sit down with the families, you go over what can they afford, what is right for them, what do they want, as well as what do they need. Mm-hmm. And then at that point in time, it sounds like you then help them to come up with a plan to move forward in the future as to what care they need. Is that
exactly?
Okay.
When
just
we're
breaking it down a little
yes,
bit, right?
When we're working with someone with dementia, it's a tough disease. It typically lasts about 10 years. Everybody's journey is a little bit different, but the one positive, if there could be a positive about dementia, is it's pretty predictable. So we know it's not going to get better. We know it's not going to stay the same. We know it's going to progress. So knowing that can help us to explain to the family what the future could look like.
Right.
Some people can go to assisted living and receive care there for the rest of their lives. Other situations come up where there are too many medical needs for that to be an appropriate placement. So we help with that. One of the things that I always like families to know is that as members of our professional association, we're prohibited from having any financial tie to any resource that we recommend. Right. So that keeps us entirely objective, and our only goal then really is just to make sure that their loved one gets the same care we would want for our own.
So once you help somebody to kind of figure out that next game plan, that next plan that's going to happen for them, mm-hmm, do you continue to work with people to help them? Because obviously, as you age, things don't necessarily get better all the time, and people need more care oftentimes, mm-hmm, so if you have somebody that's, let's say, in an assisted living, and then they need to get reassessed, and let's, like you just said, maybe they have more medical needs that is not an appropriate setting for them. Mm-hmm. What do do you help people at that point in time too? Do you kind of stay with them throughout this whole phase of their life?
Yeah. We absolutely can. I really leave it up to the families how they want to use us. Mm-hmm. Sometimes they just need help navigating a crisis and getting things settled down. They might live locally and can check in on their parent or their loved one. But this is a very different world than it was 30 years ago. I have two sisters who live in different states. That's not uncommon. So a lot of times the family members are caregiving at a distance, and they can't be the eyes and ears on the ground. So that's us. So it all depends on what the families want. Like I said, we can help them through the crisis, or we can stay involved. We have many clients that we've been looking after for years.
And when you stay involved, what types of things are you continuing to do in trying to help somebody or help a family?
Well, as an example, if we have someone who's at home with a home health aide who lives with them, yeah, we would visit them more frequently. We will take them to their doctor's appointments. We'll make sure that the doctor gets accurate information so that any treatment plan is appropriate to what the need is. A lot of times folks of the older generation will have a lot of complaints, but when the doctor walks in the room, they're fine. Right. When the doctor says what's going on, so we're there to say,
it's all good.
Yes, it's all fine. Also
right.
Nice to see you, doctors. But we'll say, remember, we wanted to let the doctor know you had this ache or pain, or that your blood pressure was running a little high. So we do it in a way that spares the person's dignity, but we make sure that the doctor has the information. If we're going to those appointments, we can manage the medications. So we would set the medications up in the house, manage the refills, and then the aide who lives with them will give them their medications. But like you said, Aging is a process,
Right.
and things tend to get a little bit harder. So as long as we can keep someone in the home, as long as it's affordable to them and sustainable, we do that. But if there comes a point where it's really just not appropriate, it's just not enough care at home,
Right.
then we would counsel the families on, it's time to take the next step, and we talk to them about that and then help connect them with the right place.
And one of the things that you said, I think, is just so important, and I just want to reiterate it because in a different way, because I get it so frequently, where you have people that are living at home, and then they're going out to doctor's appointments, but maybe they don't have somebody that can take them, right? And it's really having that second eyes and ears where maybe other family can't be there because they have other obligations themselves. And so to have a second person in a doctor's appointment to hear maybe even what you're not hearing is so helpful. And is that something that people really value in the services that you give? Because I personally would think that would be fantastic to have.
And because a lot of us, even the social workers on my staff, besides the nurses, have medical background, we often know questions to ask that the family wouldn't even know to ask.
Sure.
And that's true especially if someone is in a hospital too. If we're seeing a client on an ongoing basis, we follow them wherever they go. So if they're in the hospital, we're right there too. We're speaking with the doctors. We're not the decision makers.
Right.
The family's the decision maker, but it's our job to tee everything up for them, to ask all the questions and give them the best information and guidance so they feel good about the decisions that they're making.
That is so critical. And I think because, I think the terminology, you're very familiar with the terminology, I'm very familiar with the terminology, but most people on a daily basis don't hear the medical terms that we hear and don't understand necessarily, okay, this is what they're telling me, but what does that mean for me on a daily basis?
Right.
And how do I handle that?
Right.
That to me is such a critical service that you guys provide.
Right.
So, so talk to me. There's two aspects to your company, Peace Aging Care Experts. Talk to me about both of those.
So the primary part of our business is our care management business. So that's our staff of nurses, social workers, and now an occupational therapist, and we're doing the work that I just talked about.
And how many people do you have on staff?
Right now we have 10 care managers, and I love the work. So even though I run the company, I'm always going to do care management work. I can't get away from it. It makes me feel good to know that I can open my mouth and help a family. Yeah. So we have 10 care managers, and then a few years ago, actually, it was right before COVID, I had always had this dream of having a recreation program for some of our clients. Certainly during COVID, it became very clear how isolation can be harmful to someone who's especially suffering from cognitive issues. But I created the SPICE activity program. It stands for Specialized Program for Innovative and Creative Engagement. And I have 2 recreation therapists on staff. And what they do is they go out and meet one-to-one with our folks who have mental illness or cognitive disabilities. And we engage them, they're engaged one-to-one in customized activities meant to meet them where they are cognitively and to help them feel successful and good about what they're doing. So it's been a tremendously popular program.
And how long has that program been going?
That's been around since, we're actually going into our 4th year with SPICE.
Okay.
Yeah.
Well, Trish, we're going to take a quick break.
Okay.
So everybody come back and rejoin us so you can hear a little bit more about all the fantastic programs that she's doing. And we'll be right back. Thank you so much.
Hi, I'm Bob Hokertl from Kings Road Brewing Company. I'm here to tell you about a brand new show on RVN television called Cooking with the King. Each week, we're going to taste and sample some of the best beers the Kings Road Brewing Company has to offer. And we're going to talk to area chefs and restaurant owners as we pair our beer with their signature dishes. We're going to teach you how to cook and eat like a king. Cheers.
A stroke can be easy to detect. A loved one can't speak, perhaps they can't move. But there's another sign of a stroke that many of us can't see. It's called spatial neglect, and it can occur during or after a stroke, causing distorted visual movements. Fortunately, there's a solution by using optical prism technology during rehabilitation. If you or a loved one have experienced a stroke, Ask your doctor about spatial neglect. Spatial neglect. See the whole picture at KesslerFoundation.org.
Are you burned out, disenfranchised, disengaged, extremely distracted? Do you feel that you're lost in semantics, over-leveraged, overwhelmed? My name is Lisa Fratelli, and I have a show on RVN TV, always streaming. The name of the show is The Neuroscience of Wealth and Well-Being. The intention of this show is to explain how you can get back to homeostasis, flow states, creativity. It's highly correlated with happiness and well-being. So you can get out of overwhelm, get out of burnout, not feel distracted, and get back to your life. You will hear from experts who will get you back on track so you can enjoy your life again. RVN TV, we're always streaming.
Hi everyone, and welcome back. Today we have, again, we have Trish Barbosa. She is a certified geriatric care manager and owner of Peace Aging Care Experts, LLC. And we've been delving into a little bit about your program, about everything that you do in trying to help people to figure out how to handle either a crisis or how to handle that next step and progression through people's lives, right?
Mm-hmm. Yeah.
Okay. So talk to me a little bit about, the title of our program is called Advocating for the Aging, right? Mm-hmm. So do you consider yourself an advocate?
Oh, 100%. I'm an advocate.
And it's not just for the aging, right? I know that you also help people with developmental disabilities as well as mental illnesses as well.
Right.
So talk to me about how are you an advocate?
So what we do, it probably wouldn't surprise you in your position to know that there's a lot of ageism out there, and a lot of it is unconscious. Even taking someone to a doctor, sometimes the doctors talk to me instead of talking to the patient who's there. So a lot of what I do, we redirect the doctor and we get the information, but we always want to spare the dignity, and not even just spare the dignity, we want to promote the independence of the person that we're with. So, but in the hospital situation, that kind of environment, it can be very easy to overlook an elderly person. And so a big part of what we do is identify that person. For instance, if someone goes to the hospital in the middle of the night and we can't get to the hospital in the middle of the night, we are on the phone out of bed with that hospital, giving them the background information that they need to know that it's not just an old person with gray hair laying in a stretcher. That person has a story. That person has people who care about them. And so we share that information as well as all of the medical information.
And they also have wants and needs, right?
Oh, for sure.
Because I know I've run into situations too where, somebody, it may be getting at-home care or getting, some other type of care, and then you have a hospital that says, nope, you need more care, you need to go to a facility, so we're going to discharge you to a facility, so get yourself ready, you're going. And then you come screaming in and saying, no, but that's not what they want, right? They've clearly identified that this is not what they want out of their life care plan for themselves.
Exactly.
So, I'm sure you've run into a number of those situations too.
For sure, and I do say discharge planners at the hospital have a really hard job. Right. They have to get people out when the insurance stops paying, and they can't be too picky about where the person goes. So they tend to give families a list of 30 nursing homes in the area and say, pick 3, and I'm going to send the paperwork there. So, but as care manager, I'll come in and say, hold everything. Not this facility, not this facility. I want these 3 facilities, so that at least we can help make sure that, my job is to make sure that my clients get the very best care, what I would want for my own family. So, and I know which facilities offer the best care.
And that they can make an educated decision for themselves,
yes,
right?
Yes.
So talk to me about, we've talked about a hospital type situation. What about for people that are residents of nursing homes or long-term care facilities? Do you help them to advocate for themselves in that type of an environment too?
Oh, definitely I help them to advocate. And a lot of times what I'm doing is I'm helping the families to advocate, because sometimes when someone's in a nursing home, the person's not really able to do that for themselves anymore. Right. But yeah, so we help the families. We let them know what's important. Like I said, we tee things up for the families and let them know what's not right. We never tell a family a problem without at least a couple of solutions for them, because it's our job. It's not our job to point out what's wrong. It's our job to let them know what solutions are, and we help so they feel good about the decisions that they're making.
Right.
Yeah.
Because I could see some overlap potentially happening between yourself and the Ombudsman's office and some of the other advocates that are out there. So what distinguishes you as a geriatric care manager who's trying to help somebody in that type of a long-term care environment versus the Ombudsman or the Department of Health?
Well, we're usually much more personally involved with our clients. We love our clients. We love the families. And we're actually there frequently. We might pick up on issues, we often do, that we need to have addressed. I would reach out to the Ombudsman if I have worked with the facility and haven't gotten satisfaction, or if there's an emergency situation where I'm concerned about my client's safety.
And do you also, for residents of long-term care facilities, whether it be assisted living or nursing homes, do you also attend care planning meetings? Is that something you guys do?
Oh, I call them together. Okay. Yes, I sure do. I
call the meetings.
Yes, I definitely do, because I think it's so helpful when someone especially is in a rehab situation that we have all the heads of the departments together, including nursing, social work, rehab, the family. And if it's appropriate for my client to participate as well, I want the client there, because I think, again, we want people to advocate for themselves and say what their preferences are. Right. But yes, if we all put our heads together, we all get on the same page. And I think that's critical.
That's great.
To a successful outcome.
That's fantastic. And so are there other groups that you work with outside of your company that you team with? I know you were talking about working together with elder law attorneys because that's something that's really important too, because you got to have the financial aspect as well as the care aspect, right? Are there other outside professions or areas that you work with in your company?
Sure. We're known to be resources. So we work, a lot of times we're called into situations where someone's hoarding. So we know companies that can go in that can help clean out the house. We have certainly home care agencies, home modification companies, doctors, facilities, outpatient therapies. We run the gamut. We have an extensive list of resources, and it's constantly being updated because the world is changing. And so we just tap right into that and figure out what's right for that client.
Well, talk to me just really quick about, since COVID happened, because in this area, in this world that we are a part of, there's been so many changes, so many issues that have happened, but so many changes. What was the biggest thing that you've watched, because your company definitely existed before then, so what's the biggest change that you would say has happened for you in your practice from pre-COVID to now?
Oh, so much has changed. I would say if one good thing can come out of COVID, besides being able to eat outside and so many more restaurants, it's Zoom. So we realize now how important socialization is. We always knew it was important, but during COVID, it was so clear that the isolation was just really traumatic for people. So one of the things I say to families is, you need three things to be happy: something to do, something to look forward to, and someone to love. And we try to take those elements and bring them to every client that we have, so that they can have a more fulfilling life. COVID certainly made that a lot more challenging, because for a period of time we couldn't actually see our clients face to face for a while. But now that we can again, we always try to bring those elements in. Besides making sure that the medical care is right where it needs to be, we want to make sure that there's fulfillment in their life for whatever stage that they're in.
Right. That's fantastic. So I think I saw from your website that you mainly service Central and Northern Jersey. Is that correct?
That's correct. We're from about New Brunswick and north in New Jersey right now.
And so if somebody, because obviously, not obviously, but there has to be other people who do what you do as well too. Are you connected? Is there any sort of organizations, or are you connected to other people in the state that do this as well? If somebody in South Jersey needs that kind of assistance and care?
Yes, I'm actually part of a national association, which is called the Aging Life Care Association, and their website is aginglifecare.org.
Okay.
And family members anywhere can go to the website, click on Find an Aging Life Care Professional, put in a zip code, and it'll come up with a list of members of the organization. Everyone in there is not just a member, they're also credentialed by education, experience, and certification. So you almost can't go wrong with anyone who's in the organization. And we're bound by very strict standards and ethics.
And when you talk about those strict standards and ethics, I think one of the things that kind of just stood out to me is I know you were talking about these outside groups and outside services that you work with or that you're familiar with, but you don't receive any sort of kickback or anything along those lines, right?
There is no financial tie between any member of the Aging Life Care Association and any service that they recommend. Yes,
that's fantastic.
Yeah.
So tell us, out of everything that because you've done, you've had so much experience in your life, right? You've been an RN in various types of areas, but you've also tried to help people in so many different types of ways, right? For somebody who may be going, or families that are about to start going into this situation, and they're aging, what do you suggest people do in order to try to prepare for what's coming?
Right. I think it's very important for them to meet with a geriatric care manager, so we can get a feel for what's happening now. Like I said, with dementia, it's sort of predictable. So even though it might just be a mild cognitive impairment now, that could become more challenging over time. It's important that they have their paperwork, their power of attorney, their advance directive, and that they have a really great geriatrician on board who knows what to expect and knows how to safely treat someone for whatever conditions they're dealing with as they age.
Okay, and for somebody who may be in the throes of a crisis, right? Something didn't happen or didn't go the way they thought it would, and now their whole world is turned upside down. They need, a ton of care. They need they don't know whether they can financially afford all this.
Right.
How do you tell them to take that deep breath and to contact somebody, and how do they reach you in trying to get that kind of help?
You can find me by contacting my office, or you can go through the Aging Life Care Association, and it provides all the information there of how to reach someone in their area wherever they are. And care managers are used to being called into crisis. That's most of the time that's when people really find that they need us, and so we're always there ready to jump in.
That's fantastic. So. With regard to your company, how do people find you specifically? I know you said you just go to the website,
well, they can call
how do they find you specifically?
Yes, they can. A lot of times they find me through elder law attorneys, or they can find me through the website. Do you want my phone number?
Yeah, you can certainly you can put your phone number out, website
sure.
out, and any information to try to help people be able to find you. That's
sure,
the best
absolutely. So our office phone number is 973-459-9966, and our website is peaceagingcare.com.
Fantastic.
Yeah.
Well, I really want to thank you for your time today. Is there anything else that you want to let people know about what you do and how you do it, and or any other pieces of advice that you can give to people?
Yeah, absolutely. Aging is difficult, and we're all getting older. Right now we're dealing with the silver tsunami that is coming with a lot of people in aging. So, my best advice is to reach out for help, understand that it's available, and reach out.
Thank you. All right. Well, thank you so much for your time today. Again, you provide such a critical service that so many people just don't even know exists. So if you are reaching those stages of needing possibly some more assistance down the road, or if you are in that crisis mode, definitely reach out. I know that Trish is more than happy to help you. She certainly has helped clients of mine, and we've communicated about other clients and have worked together on certain issues ourselves, and to try to help people. So before you get there, definitely reach out to try to prior proper plan and help everybody have as much of a smooth and easy transition through the rest of the progress of their life. So again, thanks so much, Trish, for being here today. I look forward to having you again in the future if we can. And everybody join us again for our next episode of Advocating for the Aging. And I look forward to seeing you all again. Thanks again.